10 days away from daylight saving time coming to an end. Come November 6th, sunset will happen at 4:44.
Oh, the fallback is brutal. In our neck of the woods, we sometimes joke about seasonal depression, being used to it for so many months of the year, but this really can have a tremendous impact on people.
So what are the signs and how can people combat it? We want to bring in clinical psychologist and associate teaching professor at Seattle U, Dr. Mauseth.
Dr. Mauseth, thanks for joining us. You know, we call it seasonal depression, but really there's a more clinical scientific name, seasonal affective disorder. What is it exactly, and how do we know if we have it?
Yeah, that's a great question. And it is something certainly that affects so many people in our area at these latitudes at this time of year. Seasonal affective disorder is really characterized by a fairly significant and more long-lasting change in mood. Typically, it comes with some lethargy, a little bit of a sense of malaise, not really being interested in doing things. And it's something that really affects your ability to participate in your day-to-day activities in a way that is more than just inconvenient, because we all have bad days, but this is something that tends to affect people on a deeper level.
Yeah, and you just talked about that. What are some of the signs that we should be looking out for?
Yeah, really thinking about noticing changes in activity. So if you're finding yourself significantly more tired than normal, not interested in participating in things, sort of down, that sense of hopelessness, it is characteristic of similar sort of typical what we think of major depressive disorder, but it's not caused by necessarily the same thing. We have strong reactions to the hours of daylight that we are able to access at this time of year, and as well as some of our coping skills and our activities that might not be available when it starts getting dark so early, and then it also starts raining and we might not be able to go outside and enjoy some of those things as much.
Dr. Mauseth, people who have watched us for years know I'm a big proponent of vitamin D. As long as your doctor says it's good for you, I believe that it helps with mood at this time. What do you think about that? And also, what about light therapy? Does that work?
Yeah, so the classic answer in psychology is that it does all depend. It depends on the person. You can go get your vitamin D level tested at a primary care visit. That is something that is recommended for a lot of people. And depending on what the result of that is, you might need to consider a vitamin D supplement. That's certainly something that a lot of people do. But I wouldn't say, by and large, that everyone should rush out and start taking that immediately. You'd want to get those levels checked before doing something like that. And then in terms of light therapy, one of my recommendations there would just be aware of scamming. There is the opportunity to just, hit add to cart and buy something for, $3 or $5 that says it's good to treat seasonal depression. But in fact, the type of light that some of those devices generate is not actually effective in the same way that exposure to actual sun would be. And it takes a particular type of light bulb that usually is not very inexpensive. A lot of scams, and there are a lot of sort of products out there that are designed to address this, but they're not going to do so in an effective way. So do some research before you hit add to cart.
Definitely great advice. Doctor, would you say how many people are actually impacted by this?
In terms of rates of depression, right now, because of what we've experienced over the last several years, we're looking at somewhere around the 6% mark maybe in our state with people who experience symptoms. Maybe upwards of 8%, depending on the time of year and the difficulties of other pieces of life that people are experiencing. So I can't give you an exact number, but I do know that especially for teenagers and adolescents, as well as adults, heading into the months of October and November, we do tend to see spikes in depressive symptoms and some of the malaise that I was mentioning just generally. It's a pretty common population experience. But if you're concerned about it, I would strongly recommend going and getting some assessment, talking to your primary care doctor about determining whether or not you would meet sort of the clinical diagnostic criteria.
All right, Dr. Mauseth, thank you so much for your time today.
Yeah, I mean, with the